Throughout our lives, we're faced with difficult decisions. When we're young, they're simple ones like what kind of car to buy or what college do you want to go to. As we get older, we try to make decisions like where do we want to buy a house, what school do we want our kids to go to. But as we get even older, we realize that we have to make decisions not only for us, but for people around us, and especially our elders. One of the biggest problems is what to do with elders when they lose the ability to take care of themselves all the time. And at most times, people are faced with either A, a nursing home, or B, at-home care. At-home care, to me, is a much more safe decision. There's many reasons that go into this, but the first ones, or the most important ones, are mainly the environment, the safety, and the supervision. First thing about the environment is your surroundings, the people that you're with. Typically, nursing homes, you have to share a room with somebody. That person you may not like. They may be a light sleeper. They may get up a lot during the night. They may make a lot of noise or have their TV up too loud. You might not even get along with that person. If you choose at-home health care, you're able to choose who your caretaker is and get one-on-one time with that person. Not to mention, you're surrounded by family members who love you, they care for you, and they're basically your support system. This is so important when you're trying to take care of a sick elderly person, because their support is what keeps them going. You need to know that they have people around them that love them. Another problem with healthcare facilities, nursing homes, hospitals, other places like that, are the sound levels. Hospitals and nursing homes can get pretty loud sometimes. You have carts going down the road with meals. You have IV machines and IV alarms and other conversations with nurses and other residents. A study done by the Annals of Medicine in 2012 showed that the sounds in a healthcare facility can reach up to 80 decibels, even at night when people are trying to sleep. During this study, they found that 90% of the people tested were in some way woken up by these sounds, whether it be an increased heart rate or a complete awakeness. And when you're talking about trying to get better and be healthy, sleep and rest is one of the most important things you can have. Some of these sounds were as quiet as a whisper. Just two people whispering in the hallway can cause such an overwhelming sound inside a room and just cause somebody to wake up. Another problem that we face with healthcare facilities, especially nursing homes, is simply the nurse to resident ratio. A few of the nursing homes in our area, resident nurses are faced with 30 to 40 patients per nurse. And that's crazy when you think about you only have a 12-hour shift and you have all these people to take care of. It actually factors out to being about 18 minutes per patient that you actually get to spend with a patient. And when you only have 18 minutes, I mean, that's if you're working straight through, no breaks, no lunch. That's 18 minutes per person. Studies have shown that you can even decrease the amount of urinary tract infections and pressure ulcers by spending an extra 40 minutes per patient. If a person were to try to spend in a nursing home 40 minutes per patient, the nurse would have to work right around 26 hours a day, and obviously that's impossible. If you're at an at-home care facility, you have at least 1 hour of one-on-one time between you and your caretaker, the one that you've chosen for you. And this kind of one-on-one attention is what people need to make sure they're getting the health care that they are required to get better. Another problem with nursing homes is the rate of readmission and also the rate of deaths as people are admitted. Nursing care, 80% of the patients die within the first year of being admitted to a nursing home, and 53% of those people die within the first 6 months. Studies have been shown that people who are admitted into a nursing home and then released back out on their own are readmitted, and when you have at-home care, that readmission is significantly decreased. Not to mention, when you're at a nursing home, due to that lack of supervision, there's so much more of a chance for accidents to happen, like slips and falls. The CDC estimates that there's approximately 1,800 deaths a year due to falls. And on average, for a 100-bed facility, there's 100 to 200 falls, which is a pretty crazy factor, especially when you have to understand that many of these falls aren't even reported. They don't even report them because the nursing homes don't want to get in trouble. Now, this isn't the actual nurse's fault. This is just simply due to the fact that they're so overwhelmed with patients that they aren't able to give the patients the care that they need. Whereas in an at-home environment, they can. You're there for about an hour, maybe a little more, and you can properly administer medications and ensure that the patients aren't taking their medicines incorrectly. That's another problem with nursing homes, is the patients are given the medicine and they're expected to take the medicine on their own, whereas at home the nurse can actually administer that medication correctly and ensure the correct doses are given. Another problem with nursing care facilities are infections from the general public. I mean, if you're surrounded by at least 30 to 40 other patients who are all sick, they have decreased immune ability, the chances of you getting sick are so much greater. And as an elder person, you have less ability to fight infection. And that's a serious problem for nursing home facilities. So basically, in most cases, it's a better option just to choose at-home care for your loved ones. And possibly the most important number that people like to hear is the cost, the amount of money that it saves you to choose at-home care. The cost of a nursing home facility could be as high as $220 per day. That equals $6,753 per month. That's crazy money when you think about just the average person trying to care for their loved one. And at-home care is almost half that. It's only $162 a day, and that equals out to about $3,400 a month. That's significantly less, and much more. A person's a lot more able to pay for that. Not to mention you're getting better care, you know. And a lot of times people want to come back to the argument that at-home care is more stressful for the caretaker. I mean, when you have an elderly loved one living with you, it's obviously more stress on you as a person. My wife's grandmother is living at my mother-in-law's house, and so I can tell firsthand how difficult it is to take care of somebody who has health concerns. And it is a bit stressful, but the money that you save and the hassle of going back and forth to the nursing care facility actually saves you a lot. And understanding that caring for an elderly person is very stressful, you have to understand that it's also stressful for the people at the nursing care facilities. And that stress has a trickle-down effect when it's talking about, you know, say there's a stressed out nurse who's trying to take care of so many people and they're being criticized for the kind of care that they're taking. That stress trickles down to the patient. The patient may get decreasingly less quality care at a nursing home. That's not saying anything against the nurses, it's just the nature of the beast. So those are just really a few reasons why at-home care is much better than a nursing home care. I mean, obviously, unless you're the kind of person who maybe you're just tired of dealing with it and you just want to ship them off to a nursing home and, you know, not have to worry about it as much. But if you truly care for your loved ones and you really want the best care for them, at-home care is certainly the way to go. Thanks.